In this video, we are going to see some quick notes about antiepileptic drugs. We are going to see some main points that you must remember about these drugs. So this is part 1 of antiepileptic drugs. Stay tuned for part 2 and 3. So let's get started. Benzodiazepines. Benzodiazepines includes alprazolam, diazepam, lorazepam, oxazepam, clonazepam, and clobazam. These drugs bind to GABA inhibitory receptors to reduce the firing rate. Most of the benzodiazepines are reserved for acute seizures or they are reserved for emergent situations due to tolerance. There are some drugs like clonazepam and clobazam which are used as an adjunctive therapy for particular types of seizures. Diazepam is also one of the benzodiazepines, and this drug is also available for rectal administration to avoid or interrupt prolonged generalized tonic-clonic seizures when the oral administration of the drug is not possible. So next drug is carbamazepine. Carbamazepine blocks sodium channels, hence inhibits the generation of repetitive action potentials in the epileptic focus and hence prevent their spread. This drug is mainly effective for the treatment of focal seizures and generalized tonic-clonic seizures. In addition to this, carbamazepine is also used in the cases of trigeminal neuralgia and bipolar disorder. This drug induces its own metabolism, resulting in lower total concentrations of the drug in the blood at higher doses. Hyponatremia is especially noted in elderly patients who are using this drug, and this drug should not be given in the patients of absence seizures because it may cause an increase in the seizures. Lamotrigine is also one of the antiepileptic drugs. This drug blocks sodium channels as well as high voltage dependent calcium channels. Lamotrigine is used in a wide variety of seizures like focal seizures, generalized seizures, absence seizures. The dose of lamotrigine should be reduced when adding valproate to the therapy. Slow titration of the drug is necessary with lamotrigine, especially when adding lamotrigine to a regimen that already contains valproate, because there's a risk of rash which may progress to a serious life-threatening reaction. Synaptic vesicle protein is the binding site for levetiracetam. This drug is approved as an adjunct therapy for focal onset, myoclonic, and primary generalized tonic-clonic seizures. This drug has few to no drug interactions. It is well absorbed orally and excreted in urine mostly unchanged. Levetiracetam can cause mood alterations that may require a reduction in the dose or change in the medication. Perampanel is a newer agent. It's a selective antagonist at the postsynaptic inotropic alpha-amino 3-hydroxy 5-methyl 4-isoxazole propionic acid glutamate receptor. This drug reduces the excitatory activity and it has a long half-life, which allows once daily dosing. Perampanel is approved as an adjunctive treatment for partial onset seizures. Phenobarbital is another antiepileptic drug. This drug acts on the GABA A receptors subunits. So what happens when phenobarbital binds to these receptors, the chloride ion gets open and stays open. This allows a steady flow of these ions, the chloride ions, into the neuronal cells. This action hyperpolarizes the cell membrane, increasing the action potential threshold. And this increase in the action potential is the reason why this drug is effective in the treatment of seizures. So this drug is primarily used in the treatment of status epilepticus when other agents fail. So phenobarbital is rapidly absorbed after oral and IV administration, and main common side effects of this drug includes incoordination, impaired balance, and drowsiness. Oxcarbazepine. Oxcarbazepine is a prodrug which is rapidly reduced to 10-monohydroxy metabolite. This metabolite is responsible for its antiepileptic activity. MHD, the metabolite, blocks sodium channels, preventing the spread of the abnormal discharge. So this drug is approved for the use in partial onset seizures, and the adverse effect of hyponatremia by oxcarbazepine limits its use in the elderly. So that's it. Thanks for watching. If you like the video, don't forget to like, share, and subscribe PharmCept. Thank you.